Today. So welcome to the Incarceration Prevention Reduction Task Force and Law and Justice Council meeting for October 28th, 2024. I'm Peter Frazier, along with Heather Flaherty. We are the co-chairs of the IPRTF. And while we wait for a quorum to arrive, I'm going to start with our land acknowledgement. And Jill, would you move the screen so I can see the entire land acknowledgement? Thank you. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. And I will just note that last weekend at the Pickford Theater during October, I was very happy to see the movie Fish Wars, which covers about 50 years, maybe even 60 years of our history here in the Salish Sea region, and I found it fascinating. And yeah, I highly recommend you get a chance to see it. So let's begin today. We've got a lot of work to do today, and we'll begin. Do we have a quorum yet? Just out of curiosity, Jill?
We do.
Okay, that's excellent. All right. So we have an exercise in prioritization to undertake today, and Holly and Marty are going to lead that. But before we begin that, I want to give you some context and background so that you can see where we've been and what we're doing today, and then where we're going. So I've got a few notes here I'm going to read from. So as you likely know, Heather and I have been co-chairs since maybe it's February or March. And in that time, we embarked on this process to ensure that the Justice Project implementation plans actively supported and with clear priorities and accountability. And we gathered insights from committee members. You were all part of that. We also gathered insights from our council members and from some senior staff as well. And we explored gaps in our current initiatives, and our aim really is to make IPRTF role more action-oriented and impactful for Whatcom County. Through all this feedback and discussion, we compiled a report that was in your packet, and I hope you got a chance to read it. If you didn't, I'm going to cover it just really briefly, but I really encourage you to take the time to read that report in full. There are findings from that process, Heather's and my recommendations, and they're organized into 4 different areas: communications and community engagement, structural recommendations, kind of the process and function of the IPRTF, the focus area recommendations, and that's what we're going to be focused on today, and then policy and advocacy recommendations. And so these findings reflect both the needs that we all identified and the actionable steps proposed by committee members and ourselves to make headway. So some of the high impact areas include enhancing communication, data integration, and strengthening diversion programs, not surprisingly, but there were others. And this framework helped us to narrow down the actionable focus areas to bring some clarity. And we have so much to do in IPRTF and so many things to focus on. We know that we can't do everything all at once, and so it is our intention to bring some focus to all these important things that we're doing. So from the report that I was referring to, we identified these focus areas, and then we over the last two IPRTF meetings, we took the time to go through the implementation plan projects and kind of make alignments around them, and to focus on areas of responsibility. Who at the county is best suited to take responsibility for this? Which committee of ours is best suited to take on that? And that whole kind of mapping process hopefully was helpful to everyone, and we have that also in your packet, and something that we can all refer to as time goes by. The next thing is we took all this work, and then we distilled, after our last meeting, distilled things down into 10 goal areas. So those areas are also in your packet, and that's what we're going to be working with today. So today's prioritization exercise will be interesting. We kind of gave it a little try in our steering committee. We've got a technology, I can't remember what it's called now, but it's going to help us all to make some choices on the fly around prioritization. And it should become a kind of an actionable blueprint, if you will, to help us move forward into our next steps. And speaking of our next steps, once we're completed with this, it's our hope that each committee will further discuss the goals and the prioritizations. The aim is to integrate them into an 18-month work plan with specific strategies and tactics for each of the goals, and that should lead to concrete recommendations aligned with our advisory role. And so in the November and December meetings, it's our hope that we'll conduct a mapping exercise to finalize and adopt an 18-month work plan for all the committees, and this committee included. And by the end of the year, we'll aim to have clear, actionable steps, kind of roadmap. And today we are working with these 10 goals. So Holly, would you like to take it away? Was that a good context? Heather, if you're on, is there anything you would like to add before we get started? I'm not seeing Heather. Oh, there you are, Heather.
Heather, did you want to jump in? Okay. Hey, Peter, did you want to go through the PowerPoint that we used, the steering committee that I sent it to you, that has just the goals, if we want to just look at those as a group?
Oh, that would be great. I guess everybody's got their packet, but it would be good to get them in front of everybody.
Good morning. Can you hear me okay?
Oh, yeah. Hi, Heather.
Good morning. I was trying to get Booker to go to sleep, so thanks for your patience. I think that was a really nice opening, Peter, and I'm excited to hear from everybody today. what your priorities are, because I think that that'll feel really gratifying at the end of next year for us to be able to point back and say, here's what we all worked on together and here's what we were able to accomplish. And so I just wanted to add that as part of the framing for the exercise today. And then I think, Peter, you explained pretty well where these 10 goals came from. And none of them should be a surprise because they came from Peter and my meetings with all of you and you telling us what you wanted to work on, and then us compiling it all and aligning it with the implementation plan and with the scope of the IPRTF. So none of this should be a surprise to you, but it's a methodical process for us to go through so that we can all build commitment and ownership to what the work will be for next year.
Great, thank you.
And
So
Holly, I'm struggling to find, oh, wait, here it is. I'm not going to be able to bring it up, but I can read it.
I can bring it up too. So
Okay.
basically, here's the plan. We're
I was
gonna
unprepared for that,
flash,
sorry.
all good. We're gonna just we have a slide deck just going through all 10. And then after we've just made sure everybody's grounded in what the 10 goals are, proposed goals, we'll have each person go around and we'll do it as a roll call and you'll state your top 3. And Marty's going to pop up on the screen one of those Miro interactive things where we can like then dot it. Basically, it's dot prioritizing using Zoom. Okay. So first we're going to go through them. Then we're going to go around and each speak to our top 3 priorities, and then we'll look and see what we've got. All right. Any questions before we start? Okay. So Peter, I think you can I'll share screen, and then you could just read these out loud, just in case people didn't get a chance to look at their packet. It's probably better.
Not a bad idea to repeat.
Yeah.
Okay.
Okay. Got it?
Yep.
Okay, here we go.
Okay, I'll read them. Goal 1, create a data dashboard to track key metrics and support data sharing between criminal justice and behavioral health organizations and the public, and promoting transparency and informed decision-making. Goal 2, develop systems to improve communication and coordination between behavioral health providers, working with justice-involved clients, ensuring seamless care and integrated service delivery. Goal 3, strengthen and evaluate diversion programs for justice-involved individuals with behavioral health and substance use disorders, focusing on improving outcomes, reducing recidivism, and providing alternatives to incarceration. Goal 4, adapt best practices for designing and operating the new jail and behavioral care center to meet Whatcom County's specific needs, ensuring effective service delivery. Goal 5, identify additional facility needs to support individuals with behavioral health and substance use disorders at risk of incarceration, ensuring resources are aligned with community needs. Goal 6, enhance reentry services such as case management, peer support, housing, and healthcare to reduce recidivism and support successful community reintegration. Goal 7, expand supportive housing for individuals with behavioral health issues and a history of incarceration, providing stable housing to reduce recidivism and support recovery. Goal 8, implement court reforms to reduce incarceration rates, decrease pretrial detention, increase case resolution efficiency, and expand alternatives to bail for more equitable outcomes. Goal 9, periodically update and apply the sequential intercept model, also known as the SIM, prioritizing key gaps identified by subject matter experts to reduce the jail population of individuals with mental health and substance use disorders. And goal 10, research and recommend best practices across all incarceration prevention and reduction task force domains to improve program effectiveness and drive system-wide improvements. So these are the 10 goals that have filtered down, that we found common to all of the recommendations that you all came forward with, and that we have from our implementation plan and all of the work that we've been doing. So there they are on the screen all together.
Great. Thank you, Peter. Okay. So it's a big list, and these are obviously all important, and they're all connected to us being able to help support the implementation of the Justice Project Implementation Plan. And the question that we're asking ourselves today is, which are the top priorities for the coming 18 months? Like, if we're really going to put them, our focus, our attention, our resources as the IPRTF, where do we think that those focuses need to be? So Jill is going to do a roll call and speak out everybody's name. And at that time, you'll want to say, my top priorities are 1, 2, 3, and you say each one. And then Marty's going to put up a screen here in a second. Marty, you ready? And we'll just start the prioritization process. So Jill, are you ready to do the roll call then?
I am.
Okay. I think
When I call your name, you can read out the goal numbers in the order that you prioritize them. Arlene Feld. Arlene, you're muted.
You're still muted. And it might, if you don't have background noise, it might not be a bad idea to just unmute yourself so you can be ready when you get called on.
Sorry.
Arlene.
No worries at all. No worries at all.
Sorry about that. My first goal is number 2. It's been my experience that the failure of systems is primarily due to a lack of communication between silos, and some very important things have happened regarding that. My second goal is number 3. To continue and improve diversion programs. I don't have a third.
Okay, great. Thank you, Arlene.
Thank you, Arlene. Kevin Turner.
Morning. First one's number 4. Next was 3. And my third was number 1.
4, 3, 1. Thank you. Barry
These seem to
Buchanan.
have the most crossover with law enforcement, and just from the law enforcement perspective, it seems like that would be worthwhile goals for us to hit first. Thanks.
Thank you very much.
Great, thank you. Barry Buchanan.
1, 4, and 8.
Thank you, Barry. Kim Lund.
1, 3, and 10.
Thank you. Bertie Safford.
1, 4, and 6.
Thank you, Bertie. Maya Vano.
3, 6, and 7.
Thank you, Maya. Dan Hamill.
I don't know, 2, 3, 4. No, I have a question after we're done doing this polling.
Sure.
Thank you, Deanne. Mike Hilly.
Yeah, good morning. Sorry for the delay there. For me, number 3 is my priority. Number 2, and then as well as number 10 for number 3. Thanks.
Thank you, Mike. Next on the list is Deborah Hawley. I don't see Deborah here, so Deborah, if you are here, please unmute. Yeah, it looks like she's not here. Next, we have Dean White attending from Elora. Dean? You're muted, Dean.
Had to check twice. Melora's priorities are number 10, number 4, and number 9.
Thank you, Dean. Next on the list is Donia Edwards. I also don't see Donia attending in the list. If you're here, please unmute yourself. And I'm not seeing Donia. Next is Peter Fraser.
1, 4, and 8.
Donnell Tanksley.
I will say it's very strange that we have to pick only 3. So it's very difficult for me, but being with the group, I'm just going to say 1, 3, and 4. And just for the record, all of these are important, and all of these should be a priority.
Thank you.
Thank you. Raylene King.
Thank you. 1, 6, and 5.
Next on my list is Eric Davidson. I don't see him in attendance. Eric Davidson, if you're here, please unmute. And next we have Kyle Nelson for Rebecca Murtagh.
Priorities would be 4, 5, and 3.
Thank you. Eric Ritchie.
631.
Next on my list is Rosa Hunter. I don't see her in attendance. Rosa, if you're here, please unmute. Next on my list is Eric Peterson. I also don't see Eric here. If you're here, please unmute and vote. Okay, next is Satpal Sidhu.
1, 3, and 4.
Evan Jones.
Good morning. 1, 8, and 10, please.
Thank you. Next on my list is Scott Cordice. I don't see Mayor Cordice here. If you are, please unmute. Okay, Heather Flaherty.
My vote is 1, 4, and 8.
Tammy Bennett.
I have 3, 4, and 8.
Jake Webush.
2, 4, and 6.
Next on my list is Tracy Cruz. I don't see Tracy here attending. If you are here, please unmute and vote. And next on my list is Jen Lockwood. I also don't see Jen attending. Okay, I think I have everyone. Marty, did you get everyone's votes, or do you want to go back and revisit any names?
I think I got everybody.
Yeah.
Okay.
Okay. Well,
Thank
let's
you, everyone.
reflect on. Thanks, Jill. That was really efficient. Thank you, everybody. So just any general observations people want to share? And Marty, yeah, there we go. Yeah, Dan, you had a question? Go ahead.
Yeah, I guess and my Wi-Fi is a little bit shaky this morning, so I'm going to leave the camera off. But I guess I'm really struggling to understand the utility of this exercise. As Sheriff Tank mentioned, I share the exact same view. All of these things are important. We have to do all of these, all 10, and we have plenty of time to do them. So I guess this is we're creating sort of like the first 3 things that we're going to address. Is that sort of the purpose? And then we just kind of like pick off the rest of them. Like, how does that work?
Yeah. Yeah, Satpal, go ahead.
Yeah, I believe the way I was choosing was that these are the 3 things that from our perspective, from executive's office perspective, that's the 3 things I need to know sooner than later. But all these things are important. It's not that they are not, but this is from our perspective, for the design and construction, these 3 things need to be known because those things are irreversible decisions we make about the facility.
Thank you, Satpal. Heather?
I'd add too, just from kind of a project management standpoint, this helps this helps me and maybe Peter too, thinking about agendas and how to help just populate agendas, where the energy is for work. And I think all 10 are within our purview, and we'd like to advance on each of those in some ways. But also hearing people share where their priorities are helps us see where natural affinity work groups might emerge to move something forward. Like periodically updating and applying the sim, right? Melora was the one vote that was a top 3 for her. So from a project management standpoint, that makes a lot of sense. She's internal staff. She has the data and information to update that. And so now Peter and I, or Jill or Barry or the steering committee could talk to Melora and say, hey, how would you like to advance that goal? How can we support you in that? Whereas goal 4, right? There's a new jail and behavioral care center that needs to be designed now. And maybe that becomes an IPRTF standing agenda item. And the facilitators can then think about what are the best ways to get the information out of this task force that would actually help the executive's office and shape the productive conversations or work groups to be supportive to that process. Is that helpful to hear some of the thinking behind that, Dan?
Yeah, thanks for clarifying. I appreciate that. I do very much think that we have to tackle all of these items eventually, and I get the whole project management perspective. I do find it ironic that goal 7 only got 1 vote, and I would have voted for that had I not done 2, 3, and 4. Without that supportive housing, we're gonna keep running into issues, but it's another topic, another day for discussion.
Great, thank you. Peter?
Yeah, and I absolutely hear what you're saying, Dan and Tank. These processes are imperfect, but they, as Heather explained, I think that, and Sat Paul as well voiced, this is a way of helping us rank, and the affinity part is just so critical. Like, for instance, I'm looking at goal 8, implement court reforms, which is one of the most important things I think we can do to move diversion forward. And I don't remember who voted for those, but I am going to be interested in following up with them, because that is an affinity group that that I can work with, because I know that's a big priority for me to help move that one forward. And so there are probably a number of things like that, Dan, that are going on here, that useful ways we can use this ranking. Thanks.
Great, thank you. Dean?
I just want to share a concern. Melora has expressed that while this is work that the task force is trying to prioritize for itself, a lot of this work depends upon pretty robust staffing. And for example, she has mentioned concern about the need for a transition team to work on the preparation for the construction of the new jail and the behavioral care center. And given the current status of county budgeting, there's concern about where will those people who need to be devoted substantially to transition work come from in the county budgeting process.
Yeah, thank you. Okay, anything else people want to say in reflection of this? Okay. I have a process question for the chairs and for Jill. Are you going to be taking this as this moment as our prioritization process, or or do you anticipate following up with people who weren't able to attend today?
I think in terms of process, if there are additional members who want to identify their priorities, they can certainly do that. For it to be an official vote, we would need to do that in a public meeting. So hopefully then maybe at the next meeting they can attend, or at least we can present their preferred options and allow the task force to incorporate those into the final tally.
Well, let's figure that then afterwards, because we also need to bear in mind I'm thinking from what Peter had said earlier, we want to start developing this action plan. So we'll have to kind of hold the tension between those two options. Dean, did you still have another comment, or did you? Okay, great. Kim, go ahead. And I think you're muted. Still looks like you're muted. So Dan, why don't you go ahead and unmute so we can be ready as well. Go ahead. Yeah.
I'm sorry about that. I am hosting a series of budget meetings with council members in the mayor's boardroom starting now. My apologies, I have to go, but I'm glad I got to vote. And I wanted to say that Jason Corneliuson, our Health and Human Services Manager, is going to be staying on for the mayor's office. So thank you all.
Okay, terrific. Glad you could be here, and I'm excited that Jason can attend. That's terrific. Okay.
Yes, thank you.
Thanks. Okay, Dan?
Hey, Mayor, is she still on? Is Mayor Lund still on? I thought that meeting started at 10. I was just gonna bounce over to that real quick. Anyway, regardless, I want to get some clarity from the chairs as to Dean's question that Melora's concerned about the interplay between what the recommendations are here today and then how those will be supported with staff largely from the county health department, but that also might mean sheriff's office and executive's office. Like how does that work? Is there a plan moving forward for, say like goal 4 for the design and operation of the new jail and behavioral care center? I don't see any jail planners on the call today. I'm just wondering how does that process, or how has that process been thought through?
Yeah, Paul, thank you.
Yeah, Dan, the process has been going on. We have a group with sheriff, our office, and I think prosecutor's office to start the basics of the jail. We still have to come up with the number that we should start, and we'll put it out to the community, and the timeline. So yes, we have been a little bit delayed because we have been so busy with the biennium budget, and our September October, and I think whole November, part December is going to be busy with that. And but I think that we did, after doing the training with the NIC, we have started the process of doing that design and bring it back to the community. Yeah, anybody else, please welcome to add to that. Thank you.
Thank you, Paul. Kayla?
Yeah, I just want to echo what Paul said. We have a sort of fully staffed internal planning team and are staffing up further. We, it's a little, right, like we also have the Finance and Facility Advisory Board, which is the body that's sort of charged with making formal recommendations on the design and operations and budget of the jail and behavioral health treatment center. I think, we will be consulting with the IPRTF around program model and policy related decisions. I think sort of if the IPRTF can work to sort of consolidate it, what their primary policy goals are related to the behavioral care center and the jail, and transmit that feedback to the council and the executive and the Finance Advisory Board. And if Heather and Peter can relay that as well in their participation on the Finance Advisory Board, I think that is sort of the best mechanism for coordinating with staff.
Terrific. Thanks, Kayla. That was really helpful. Tank?
Yeah, I'll also add that there are internal meetings happening, and there's a lot of work that needs to be done internally with these small groups before the design team and all those other folks come on in 2025. So although the executive is correct about slight delays overall, what's not being delayed is those internal meetings that's happening each and every week. So yes, I mean, we're working really hard. And in 2025, there would definitely be more information publicly. But there's a lot of things behind the scenes that has to happen. And in terms of that transitional team, that's a big part of it in terms of the amount of people that we need internally that we're going to have to take offline, because to have people part of this project, especially with the sheriff's office and other divisions and departments, it's not part-time, it's full-time commitment. So we're looking through that. We have space challenges too, because when you pull those people offline, now you have to figure out where those people are going to work. So it's a lot of planning going on.
Yeah, thank you, Tank. Peter?
I want to check back in with Dan to make sure that he's feeling heard, and if those were helpful in clarifying, and also to say that in our role as an advisory body, we want to focus that role of being recommenders, researchers, recommenders, and committee by committee. And Heather and I are committed to, over the next month, working with chairs and committees to help to focus what it is that we do here in our advisory role in each of these committees to move us forward, to make those helpful recommendations, to make those play our role the best we possibly can, so that we can move everything forward. And that's what the next two meetings are, and the next 2 months are going to be about, is an 18-month work plan where we know what we're going to be talking about when, and what it all rolls up to, and having strategies to meet each of these goals in each of these committees.
Great, thanks. Heather?
Dan, did you want to respond to Peter?
Yeah, thanks for the opportunity. Yeah, I was just looking for clarification. The actions that we're going to be taking here will be some of the most consequential actions that we'll undertake in our lives. And it's a shift in direction for the task force. Typically, we have not done this. We've been in more of an information gathering capacity for quite some time now. And this is really asking for us to create a plan and then execute on that plan. So I just want clarity, and I want to make sure that when I go back to my committee, when Stephen and I go back to our committee, that we are able to effectively lead it. That's really the main goal here. So that's where I'm coming from. So thank you for the clarity. I appreciate it. And I need to hop off in about 15 minutes. I've got to go to a budget city council work session here pretty quick.
Okay.
Thanks.
Anything else, Heather?
Yeah, I'd love to just say I really appreciate the question, Dan. And I think it helps us also inform what our next steps are as co-chairs and facilitators and steering committee. Peter and I had talked about, after seeing, this is just a pulse check, really. Where is their energy? Where is their excitement? Where are their, areas of high priority? It's all important. What do we want to do first, second, third? How do we pace it? And Peter and I have talked about the next step being meeting with the co-chairs of the committees to then start to parse out, where do each of these topics actually go? It makes sense. There's some that make a lot of sense, an alignment that some topics would go to the Behavioral Health Committee, and then we would love to support you and Stephen in your leadership in making those a priority for the year. In addition to, this is not the only thing, but in addition to where your committee wants to go, whatever information gathering is helpful, and that learning and development piece that we have been doing. And I also want to say that asking about the staff connection, even just having those kind of top 4 gatherings of priorities, we see that the jail and the behavioral care center is really high on the list. And then you asked the question about how are we aligning with the staff work? And if we didn't know to ask that question, we wouldn't even have the information today of, oh, there are internal groups working on this. And so it helps the task force as oversight and accountability and transparency with the community as well, be able to know what are helpful questions to ask, like who is on that work group, and are there even moments this year where some research or policy or recommendations on behalf of the community from this task force would be helpful, even though it's an internal staff process. So it is messy, right? It's like community, government, big projects. And so thanks for entertaining the process, Dan, and building it with us, really. I think there's a real invitation to build the process with us.
Thanks, Heather.
Peter?
Thank you, Heather. And one thing that I should mention that I don't think I really adequately mentioned before is that if you review Heather's and my report out to you, while today we focused on these focus area recommendations, there are 3 other areas of findings and recommendations, and we will be integrating those over the next couple of meetings. And those are communications and community engagement, structural recommendations around process and function of IPRTF, and then policy advocacy recommendations. So all those are going to be integrated. We have not forgotten about them. We heard you, and that all becomes part of this process.
Great. Thank you. Okay, anything else before we move on to the next item on our agenda today? Okay, great. Maybe pop the screen back up, screen share, Jill, to see where we are in the agenda. Might be helpful right now. And then Peter, I'll turn it back over to you.
Sure. Okay, so the next presentation is going to be under the title of Justice Project Implementation Plan, and Kayla's going to report out on Q3 Justice Project progress. Kayla?
Hi, everyone. Good morning. I just want to make sure that everyone can see my presentation. Are you seeing? Sorry.
No.
No.
Not on the screen.
Well, give me one second. Okay. Presenting with this PowerPoint is never my strong suit. You will probably remember that I always get this a little bit wrong. Are you seeing a regular slideshow or are you seeing?
We are seeing the regular
Okay.
slideshow. You're in slideshow mode.
Okay, so we're good.
Yes.
Okay, great. Okay, everyone, good morning. Kayla Schott-Ressler from the Executive's Office. I'm going to present on our Justice Project Q3 update. I gave a very, very similar presentation to the County Council last week, and just want to sort of provide a disclaimer that this just represents sort of the stuff that the executive branch has been working on related to the Justice Project, the courts, the prosecutor, the sheriff. They've all been working as well, and I'm sure they are eager to also share their good work with you. So don't see this as like the full everything that Whatcom County is doing in accordance with the Justice Project implementation plan. So as you all know, in July 2023, the County Council adopted Ordinance 2023-039 and the Justice Project Implementation Plan. The plan includes these 15 interrelated projects and 19-year win strategies. The executive branch of Whatcom County is largely tasked with the implementation of this plan. There's a few projects that are focused on sort of criminal justice policy issues that lie with other county elected officials. One of the mechanisms that we've developed to transmit information is to do quarterly reports to the County Council and IPRTF. This is our second quarterly report. We started this mid-year. So you all probably received a like 8-page memo from me with all of the updates, but I'm not necessarily going to go in order here. I just want to highlight the issues that I think are going to be of most interest to this group and the public. So on the Jail and Behavioral Care Center project, the executive convened the Finance and Facility Advisory Board in September and plans to convene meetings on a quarterly basis to focus on policy and budget issues related to the new Jail and Behavioral Care Center. In the long run, this board has sort of an expansive view as it relates to sales tax and jail per diems and other sort of matters of advice to the county executive, county council, and county sheriff. But I really think the issues of jail size, jail configuration, and operation model are going to occupy the board's work for the next year or so. At that Finance Advisory Board meeting, we flagged some issues related to site constraints and wetlands at the LaBounty site and had sort of shared some of this information publicly here and there over the past several months. Since September, we've received updated cost estimates from our facilities department, and we actually have some good news. We don't think that the mitigation costs are as significant as previously discussed. So I think at one point we were throwing around like an $8 million mitigation number, and we think that's probably down closer to 3 or so now, and are still waiting to confirm, but that's really, really good news. You also probably read in the paper about just sort of cost escalation overall on the jail project. I think our current estimates have us around $173.9 million. I may be off by $1 million, but you know, it's really early. We're not even at design yet. So these are sort of ballpark figures, and sort of per the interlocal agreement with the cities, we expect total capital costs to sort of be determined once we're a little bit further in design. But we are sort of still believe we're in the range of what's possible while still meeting our commitments under the Justice Project Implementation Plan, and happy to dive into that more if folks have questions at the end of the presentation. Just in terms of sort of like little milestones, our purchasing department is finalizing the RFQ for an owner's representative who's going to help us both with design and overseeing our construction contract. I expect that to go out hopefully this week. And then there's also an additional FTE for a jail planner to help with permitting and sort of design stakeholder conversations in the executive's proposed budget. We anticipate convening those design tables in early 2025. We definitely know everyone is anxious to be a part of the conversation, and particularly sort of the separately elected offices within county government have a big stake in how this facility is designed. So we certainly plan on having them be very involved in the process. We're also having some really strong early conversations with Prosecutor Ritchie and Eric Sigmar on the Behavioral Care Center. I know Prosecutor Ritchie is on the call right now. They're planning a trip down to King County to see some diversion programs. And then we plan in short order to convene some internal partners of the criminal justice system to build out the program design for the Behavioral Care Center. And our county facilities department's doing an update at our November 6th county council meeting, and they plan to include a little bit more concrete stuff on the jail project during that presentation, if anybody wants to tune in. So on the Crisis Relief Center, which is sort of our first facility project that's moving forward under the Justice Project Implementation Plan, we've got this great sort of interdepartmental work group between our facilities, finance, and health department that meets every few weeks. We have over $14 million committed to the project, which includes sort of recent news that the City of Bellingham is interested in pledging their opioid settlement funds towards this capital project. The county also has a budget action next week to put $1 million of its opioid settlement money in, bringing the county's contribution to $2 million. We've got about a $2 million project gap that we are still fundraising for, and we're working really closely with the mayor's office and other stakeholders on trying to meet that gap. We expect to have our architecture and engineering contract in place by the end of this year and expect to bid for an operator in early 2025. We have some ongoing concerns and questions about the operational model and particularly the financial sustainability of this facility. We really don't know what we're going to be able to receive from Medicaid. And so we really need to bring some policy conversations forward on this point. We've done some early assessment on the Medicaid billing, but we really need the state legislature to provide some clarity on this type of model before we can have any certainty of what it's going to take to operate this thing. And then we're going to include in our operator bid some requirements that they sort of individually negotiate with the MCOs to make sure that we have a sustainable operating model and plan going forward. On data, which is probably the issue I hear most about from the IPRTF and from stakeholders in the community, we're still sort of trying to parse through what it is that we're exactly trying to achieve here. I'm in my head trying to separate it out into sort of separate buckets of data work that's needed. So this is my best attempt. So I hear a lot of questions about data around jail facility usage, which is necessary to determine the appropriate size for a new Whatcom County jail. I hear questions about sort of progress, the executive's progress towards commitments in the plan. So sort of like almost like a widgets metrics, like did we do these things that we said they were going to do regardless of the outcomes of those things? I hear questions about criminal justice system metrics. I know Peter and others are sort of looking at pre-can data tools to measure progress in the criminal justice system. And then I also hear questions about sort of the impact of our services commitments of diversion programs on reducing incarceration and improving health. I think many of those are like separate things and they're getting sort of meshed into the same conversation, and that's creating some challenges. So I'm working with the health department and would be eager to work with others on this group to sort of separate those things out so we can figure out how we want to move forward on the data front. Folks know that we received this $250,000 JAG grant to work on our data efforts. So we've got health department, IT, the county council office working on spending down that grant. The health department is contracting with Village Reach for an evaluation plan. I looked at that contract this morning. And then also encouraging to work with Village Reach on sort of prepackaged tools that we might want to assess on the criminal justice data side. You all know we have a new staff person in information services, which many of you have met, Rick, who's new in this role around data, and that he's really spending his energy supporting our internal departments and separately elected officials with their case management systems, working with the sheriff's office on jail usage reports, and sort of getting our data systems to talk to one another. On the services expansion front, a lot of you are sort of in IPRTF subcommittees that talk at length on a lot of these issues and I detailed more of them in our report. But really focusing on overdose prevention and response in line with the fentanyl executive order, expansion of LEAD getting MOUD training and capacity building out to medical providers in the community, and through our first responders, through both our EMS office and the county's health department. And then working on sort of SUDP expansion, so substance use disorder professionals that can do assessments to get people into a treatment. So there's a contract moving forward to embed an SUDP in the Peace Health ER and a couple of other places in the community to make sure we're sort of the pathway for folks to get into treatment is stable. On this sort of facility prioritization question, hearing a lot from our health department and from other regional leaders and community on youth and patient needs. We really see this emerging as a top priority, and there has been some discussion at the BHASO's legislative forum about sort of a regional ask around a capital facility. I don't know if that's going to happen this year or in a future year, but definitely sort of this feels like one that's rising to the top as we're hearing from the community. So interested in the IPRTF's feedback on that. I think you all know that the Response Services Division has expanded its transportation services and really filling in gaps where WTA and other systems aren't necessarily meeting the full need of folks. So just like trying to do as low barrier transportation as possible to get people to appointments and where they need to go. And then sort of the good news to share, though not fully confirmed, is that we're expecting to receive a $7 million grant for housing services for True Blood class members. This grant's from True Blood contempt fines that are sort of being administered through Disability Rights Washington and some court-appointed monitors. The Whatcom County Health Department worked tirelessly on this very, very difficult grant application, and we've also received some really good support from the prosecutor's office and Superior Court and the public defender's office, who originally flagged this opportunity. So want to thank Maya for continuing to push on this one. So the grant has to be confirmed by the federal court who's handling this issue, and we are hoping to hear back soon. It involves some sub-grants to agencies out in the community who are providing housing services, who are constructing new affordable housing, and then some internal response division services for some light tech case management, motel vouchers, and those sorts of things for True Blood class members. So the Medicaid waiver and jail health is very much on our mind here in the executive's office. The sheriff's office, as well as juvenile, were selected as initial sites for the Medicaid reentry waiver project, which, as you all know, provides jail health services and case management services 90-day pre-release. The county has signed $2.5 million contracts for capacity building toward Medicaid go live for the sheriff's office and for juvenile. And this is a really big opportunity, and it's also going to be a ton of work for us as an institution. It's huge ramp up for the sheriff's office, for juvenile, for our IT department, who's charged with sort of putting a lot of infrastructure and spending a lot of this grant money, for our finance department, who has to process all this, and then of course for Whatcom County Health and Community Services, who's going to be providing sort of program development and health oversight support for this effort. This is all happening at the same time that we're transitioning our jail nursing and jail medical provider mid-2025. So like, this is a huge lift for us as an organization. We see it as a huge opportunity to leverage external dollars and improve health for those who are incarcerated. We know it's a huge priority for the community and a huge commitment under the Justice Project plan, but really can't emphasize enough how much we need to focus on delivering here, because there's a lot at stake, and it's a really, really significant undertaking for us. So 2025 is going to be a really big year. We've got to design the Crisis Relief Center. We're going to be working on programming and design for the Jail and Behavioral Care Center. We are going to be working on permitting the jail. We are going to be starting up the True Blood grant, and we are going to be dealing with this jail health and Medicaid waiver implementation that I just mentioned. And that's sort of just the start, right? Like, that doesn't even touch on the data work and the other stuff that's going on. So we will be looking to the IPRTF, JPOP, the Finance and Facility Advisory Board, as key advisory bodies to us, of course, coordinating with the County Council. To the extent possible, we really would appreciate sort of formal input from the IPRTF at key times, ideally through written recommendations, so we can take those recommendations, consider them, and then take them to the county council as well. So I'm just eager to talk to you all more about how you wish to engage in this work, and want to share that I believe that we've made a lot of progress, and there is still a lot more to do to deliver on these commitments. Happy to take questions.
Thank you so much, Kayla. Any questions for Kayla on what she just reported out? Arlene, you'll want to unmute.
Yes, if when you say crisis relief center, are you referring to the 23-hour crisis clinic?
Yes.
You've changed the name?
No, I think we've been calling it the 23-hour crisis relief center. I was just calling it the crisis relief center here.
Okay, I just wanted to clarify.
Any other questions? Heather.
Thank you for that update. I have a dozen questions, and I'm curious about the reentry Medicaid Healthcare Authority grant, and I'd just love to learn more about that, and if those dollars are going to pay for the actual healthcare for inmates, or if they're paying for staff, and like how would we get more information about that?
Yeah. So, I mean, this $2.5 million contract is largely a startup contract, a capacity building effort to get us to go live where we start billing Medicaid. So the sheriff's office will be working on sort of a program plan that they will be delivering to the healthcare authority. And I know the sheriff's on the call, and he may want to say sort of more about the timing of that. But you know, that plan will be a public document, and I think it's going to be mostly focused on sort of like the institutional hurdles that we need to overcome, right? Like we need to make sure that our medical record system like is integrated with Medicaid billing. Like I don't really know the details of this, right? So I'm speculating a little bit here, but I see the sheriff just popped on, and he may have more to say.
Yeah, so the waiver that we received is a $2.25 million waiver over 4 years. And the process itself is there's milestones each year, so in each quarter. So right now we just recently applied for $125,000 of that grant to kick that program off. So there's only four agencies that's in cohort 1 with that. So the HCA, it's a progressive type of waiver. So we're working with them bi-weekly to have meetings to make sure that all the different cohorts are on schedule. So more to come.
Thank you, Sheriff Tank. Any other questions for Kayla? Okay, well, thank you very much for that report, and we're going to move on to an update on the JPOP committee, and Holly and Marty will be presenting on that.
Okay, I'll go ahead with that. So I'm Marty Sullivan. For those of you who I haven't met yet, and with Holly O'Neill, we're Crossroads Consulting, and we have done and will continue to do various roles involved with this Justice Project. One of our current roles is facilitating the Justice Project Oversight and Planning Committee, which had its first meeting on October 17th. And it was very exciting. We had 23 people attend, 18 are official members. Some of you are here. And then there were 5 guests. And it was really a great group of people. There was a lot of enthusiasm for being there. Some of the people were brand new to this Justice Project work. Some of, like you, have been involved since the beginning. So it was a great mix of folks. And at the first meeting, what we did was provide a lot of background. There was an overview of the Justice Project, the IPRTF, and the implementation plan. And then we reviewed a draft committee charter and had 3 people express interest in serving as the chair or co-chairs of the committee. At our next meeting, which is going to be, we're going to meet monthly on the 3rd Thursday. So the next meeting is going to be Thursday, November 21st from 2 to 4. And we'll be approving the committee charter at that time and selecting the co-chairs. And then using the bulk of the session to get everyone grounded on the results-based accountability framework. And that's the model which was described in the implementation plan to use to kind of frame our results, to measure our results. And this framework enables us to look at both population and program level outcomes. And all of that will feed into data dashboards. So we're going to work in collaboration with all of you folks who are involved in index committee, health department people, lots of data partners that, and just try to have the JPOP members engaged in that work of identifying metrics and figuring out the best ways to communicate those out. So if you'd like to attend the next JPOP meeting, you are most welcome to do so. We'll, especially this next one, if you want to learn more about the results-based accountability model, please attend. Again, it's November 21st, 2 to 4. And the Zoom link is on the JPOP webpage. And we'll, yeah, we'd love to have any of you to any of the meetings. It's an open meeting. Are there any questions about the JPOP or what we've done so far? All right, passing it back.
Okay, thank you so much. Now we're going to move on to committee updates, and we're going to start with steering committee, and that's Barry Buchanan. Barry, if you could go ahead.
Thanks, Peter. Good morning, everybody. We had our steering committee on October 17th. One of the first topics we had was the year-end report and talked about how we're handing that off as part of a contract with Holly and Marty to prepare that report and that draft. So you'll be seeing that at the December task force meeting that'll be presented. We talked a little bit about our legislative agenda and how that's going to coincide with the council and the executive's priority list. So we're all working together. We're trying to get a good common list together. There's a lot of entities at play that coordinate in on legislative agenda lists, but I think we're going to get to a really good place real soon. So more to come on that. We had a very lengthy discussion on regarding committees, and one of the ones that I brought up was the Competency Restoration Work Group, which was not a part of the Incarceration Prevention Reduction Task Force when it was formed. Probably should have been, but Perry and I formed that a couple, two and a half years ago to look at the, how the wait times could be improved for getting people through competency evaluation at Western, the Western State Hospital. We worked for over 2 years, and we really got into the prosecutorial diversion territory a lot as a lot of the solution for this. And so with Perry Maurer retiring, we had no one to facilitate the group from the staff side. So Melora and I got together and we talked about how the logical place for this work to be is in the IPTRF. So we discussed at length about how we could integrate that work into the IPTRF, whether it go to a subcommittee or the body. We didn't reach any final conclusions. However, we did have a very robust discussion. We also talked about the Crisis Stabilization Facility Committee subcommittee and about how that needs to, we were talking about whether it should be sunsetted, whether it should be expanded to include other facilities. And we haven't landed anywhere, but that's a conversation that's taking place in steering. Peter brought up the concept of a behavioral care center work group to work on some of the research and policy issues around that behavioral care center. So Peter, would you like to give a little 30-40 second snippet on what your thinking is?
Sure, absolutely. In fact, I just wrote up a proposal for this this weekend, which I can share with anyone once it goes through steering. The idea is that one of the reasons that a bunch of us went to Nashville in 2023 to see the jail there was not so much the jail itself, but the to look at the behavioral care center model, which they developed there under Eric Botter's leadership and Sheriff Darren Hall. We were very impressed with that. That was something we brought back as a model here to Whatcom County. It was and became part of the expectation when the ordinance was written, and also in the Yes campaign for the jail levy, is that a BCC would be used as a model, co-located treatment for mental health and drug disorders there at La Bounty. So a number of us on this call have met with a variety of, maybe I think it's 5 different jurisdictions throughout the country who are all interested in this model and have implemented it or are thinking of implementing it. And there's a lot of really good learnings out there. And so I am thinking that the IPRTF should form a work group to look at that model, be helpful to the others in our staff, Whatcom County staff, particularly in the health department, I would think, and the sheriff's office, who are interested in this. And we want to be of help in putting that research forward, best practices and such, and continue that conversation.
Thanks, Peter. Yeah, that we didn't reach any conclusions on that, but Peter's going to bring that proposal to steering for us to kind of flush out those details. Arlene, did you have a question on that piece? You're muted.
I'm being good. Do you have anyone in the field of counseling on that work group?
It's not been formed yet.
Oh,
that's what we're talking about. It's just proposed at this time.
well, I suggest that you add someone.
Absolutely, Arlene. That's an excellent point. And it is a prosecutorial diversion program. And it's so some of the main players, for instance, in Nashville is somebody from the prosecutor's office, somebody from the public defender's office, and somebody from, in their case, what's called the mental health co-op. And so those 3 elements, they meet every morning, those 3 people, and they decide who is going into that BCC and who is not. So mental health professionals are a key role in this model.
Okay.
Yeah, and the one thing we're looking at, through this is how, what's the difference between the state of Tennessee and the state of Washington, and how we integrate something like this into our system.
Hank, it looks like you've got a question or a comment.
Yes, and I'll wait to see the proposal, but I'm just curious to how this proposed committee, how that crosses over with the behavioral health committee that we already have that's part of the task force.
And that was part of the discussion that we had at steering. We had some definitely some concerns based on what you just said as far as the subcommittee work. So that's still something we're going to iron out, I think, as Peter brings this forward.
Thank you.
All right. We also talked about the index committee mission statement. Bertie gave us a draft revised statement. We looked at it and we tinkered with it a little bit. She's going to bring back another draft, I think, at the next steering committee meeting for us to look at, and then we would bring that. We would let you know what that decision was. So that was steering. Peter, back to you.
Thank you. Okay, very good, Barry. Now, unless I'm missing something, I don't think we have any representatives here from behavioral health. Stephen, are you on the call? It does not look like it, and Dan left. So I guess we will.
Stephen is here. I've just given him speaking privileges. Stephen.
Oh, fantastic. Thank you, Stephen. If you could give us a little update, that'd be helpful. Stephen, are you with us?
Yes, I am. Sorry, I had stepped away for a moment.
Oh, Stephen, if you would be able to give us a behavioral health committee update.
Yeah, we are still onboarding some new members. Hopefully this afternoon we're recruiting Lieutenant Nelson himself to the committee. And we have a couple of other invitations out. We are still working on priorities, and I think things are in a lively but very, very formative stage on where the focuses will be. And so the priority process you all ran through at the outset of the meeting will, as you, Peter, and you, Heather, suggested, help be a guide for us.
Great, thank you so much, Stephen. The next one is Legal and Justice Systems Committee. Raylene, are you with us?
I am. Thank you, Peter. I'm a little bit in the dark here, but that's all right. So we had our legal and justice meeting last week, Tuesday. We had information from Sheriff Tanksley on the reentry program. We also spoke about case processing, timeliness, and efficiencies in the court. We had a stakeholders meeting prior to the Legal and Justice Committee. And so that kind of carried over on things that we felt would be beneficial to try to make some of the court processes go a little bit quicker. And on a side note, I guess I could throw in another business, but we had Dr. Bertie Safford visit the clerk's office last week, and I'm anxious to have her and others report on areas that they've seen in person and areas for improvement. So anyways, that's what I have for you. Thanks.
Thank you, Raylene. Next is the Index Committee update. Bertie, are you
Yes.
with us?
Yep,
Thank
I'm
you.
here. And I think to some extent, Barry gave a good summary, but the last Index Committee, we, at the request of our IPRTF co-chairs, reviewed our mission statement, which was quite outdated really, and updated it. And it is going back to the steering committee next time, but the gist of it is that we modified the language to reflect our true position of being advisory, whereas the original language charged us with the actual development of various data infrastructure. So we did that, and then we outlined our goals, and we had good input at the steering committee from Satpal, wanting really some stronger language so that we could make firm recommendations to the executive committee. So those are the changes that are being made and brought back to the steering committee at this coming meeting. The gist of it is that the Index Committee will be a resource that will review and advise the consultants that the county hires around data dashboard and program evaluation, that it will recommend policy when needed to assure that all the different agencies within the county are on board and submitting the same data, uniformly defined, and those types of things. So stay tuned. Hopefully we'll have a firm mission statement to return to this committee in our next meeting in November.
Very good. Thank you, Bertie. And speaking of our next meeting, let's see, we are going to have, I wanted to just give you a little preview. We're going to have a presentation from the reentry simulation that was run this summer. And so that's going to be happening as well as the work that I previously mentioned. Scott Cortice has joined the meeting, and we would like to get his votes on the prioritization exercise that we ran. And Jill, is there anybody else who has joined the meeting that needs to vote?
I don't see anyone else.
Okay. So Scott, are you game to do this?
Yeah, you're catching me pretty, I saw the tail end of it and I was reading through them. So what do I have to do here?
Just pick your top 3 priorities, what you think is most important. We want to, of course, focus on all of them, but if you had to pick 3 to focus our IPRTF attention on.
So I like goal 1 because I'm a data guy. Let's go with
Yep.
that for one of my dots.
Okay. You got 2 more.
I know, I'm reading quickly. Can you come back to me in like 2 minutes and leave the screen up?
Yeah, we sure can.
Okay.
And
Yes, we'll do that. Actually, we are pretty much done with our meeting, and half an hour early. We can address other business. We can also have our public comment. Is there any other business that people? Oh, yes, Scott, go ahead.
Yeah, 3 and 4.
Jill, just to clarify, your top 3 are which numbers?
1, 3, and 4.
1, 3, and 4. Thank you very much.
That puts me in good company.
Great. Glad you could chime in. Thanks for jumping in.
Yeah, sorry to put you on the spot there, Scott. Okay, let us have any other business that anyone would like to bring up. And Heather, I got your text. I'm not prepared to, I cannot show on my screen that nice graphic that I did. I can't really pull that off at the moment. So perhaps we can run it through steering first. So let's see. So other business, anyone, before we go to public comment?
I don't have my hand up, but I would just pick up on what Raylene mentioned in her Legal and Justice Committee report. She did invite me and others to go and observe at Superior Court, and I spent a fascinating morning there last Thursday. So I would encourage anybody who's interested in getting a firsthand look at the court system to take her up on it. She was very gracious with the time she spent with me, kind of shepherding me and explaining things, but it's an excellent opportunity. I'm sure if I spent another week there, I would learn even more. At the same time, because the court is such a big part of what we're involved with, it's a gracious offer on her part. So I would encourage others to, if you're interested, connect with her.
Great, thank you, Bertie. Jill, oh yes, Holly, go ahead.
Yeah, I just wanted to say how much I appreciated the presentation that Kayla gave. It was so helpful. It was really, really boiled it down to the high points, and I felt it really reflected what, here's what people are talking about, here's what the priorities are. And yeah, I just thought that was awesome. So just wanted to thank you.
Thanks, Holly.
And Sheriff Tank, if you are interested in giving a presentation of the same sort from your office, I would encourage you to do so. That'd be great. And Jason, go ahead.
Hey, can you hear me?
Yeah.
Hey, I just wanted to quickly introduce myself. This is my second week working for the city of Bellingham. I am their new strategic initiatives manager, specifically for health and human services. So I am here on behalf of the city representing when Mayor Lund hopped off. But as I said, I'm brand new. I've got a lot of catching up to do. There's a lot to absorb, but this is exciting work. And I just want to say hello and show my face since this is my first meeting here.
Welcome, Jason. Thank you for being here, and we'll look forward to your contributions. All right, anyone else before we go to public comment? All right, Jill, who do we have?
Thank you. We'll start in our council conference room. If you would like to speak to the task force, you can unmute. Looks like we don't have anyone who wants to speak there. We do have 4 attendees attending virtually. If any of you would like to speak to the task force, please virtually raise your hand now. And I don't see any hands raised. Thank you.
Jill, is there anybody there who is by the conference room who could unmute? There's a gentleman sitting there who
We
seems like
unmuted for him and he muted back up. So sir, if
Oh,
you'd
okay.
like to speak to the task force, you can give me a thumbs up and we can try it again if you like. Thank you. It looks like he's just here to observe.
Very good. And with that, we will close the meeting, giving you back a half hour of your schedule. Let's go out and I'll get that work done. And thank you so much for your participation in the IPRTF and Law and Justice Council. And we'll close the meeting. Thanks so much.